Dilantin. Dilantin's generic name is phenytoin, but for the purposes of this video, I'll be referring to it as one of the two known trade names, Dilantin. It's also known as Phenitec. Dilantin is an anticonvulsant. As an anticonvulsant, it's used to prevent or reduce the severity of epileptic fits or other convulsions. We'll get into how it works later. For now, let's talk about how someone takes Dilantin. Dilantin can either be taken orally or via intramuscular injection. Orally, it can be taken as a tablet, capsule, or as an oral suspension. Now, let's move on to the next bit.
The normal dose for an oral solution is 1 teaspoon by mouth 3 times a day daily, not to exceed 25 milliliters. The normal dose for a tablet or in capsule for an adult is 47 milligrams per kilogram per day, and the max is 600 milligrams per day. For a child, it's 5 milligrams per kilogram per day, and the max is 300 milligrams per day. The normal dose for an intramuscular injection for Dilantin is not to exceed 50 milligrams per milliliter for an adult. This is also not a preferred route because of the risk of necrosis, abscess formation, and erratic absorption. Dilantin can be given via IV. The normal dose for an adult receiving Dilantin via an IV is 15 to 50 milligrams per kilogram per minute, not to exceed 50 milligrams per minute. For a child, it's 15 to 20 milligrams per kilogram, and it's given at 1 to 3 milligrams per minute.
Here are some precautions and contraindications for Dilantin. So you're going to want to use cautiously with patients that suffer from hepatic dysfunction, myocardial infarction, or risk for heart attack, patients with respiratory depression, and also with patients that suffer from diabetes and hypotension. Here are some drug interactions to look out for while on Dilantin. The first drug is going to be disulfiram because it's going to increase the toxic effects of Dilantin. The second drug is going to be cyclosporine because it's going to decrease levels of cyclosporine and increase risks for rejection of organ transplants. And last is going to be atracurium because it's going to decrease effects of muscle relaxants. Here are some nursing considerations for Dilantin. It must be administered slowly. You're not going to want to go ahead and exceed 50 milligrams per minute while on IV. This is going to go ahead and decrease the risk of hypotension and cardiac arrhythmias with your patient. After drug administration, you're going to want to go ahead and assess the cardiac status of your patient.
Now, let's talk about Dilantin's action. Now, the actual action of the drug is that it blocks the sodium channels on the neurons. Sodium can't get past, so that results in a slower rate of electrical impulses being sent from the brain. Since the rapid firing of electrical impulses is being slowed, this results in a decrease in involuntary convulsions that we'll see on the outside. Common side effects may include drowsiness, confusion, slurred speech, abnormal eye movement, or problems with balance or muscle movement. Call your doctor if you have slow or uneven heartbeats, chest pain, fluttering inside your chest, and dizziness. Any rash, no matter how mild, fever, chills, sore throat, swollen glands, swollen gums, mouth sores, easy bruising, unusual bleeding, purple or red spots under the skin, or any sort of liver problems, loss of appetite, upper stomach pain, dark urine, clay-colored stools, and jaundice, the yellowing of the skin or eyes.